Well, hello again, everybody. That was just fantastic. So as promised, I would love to introduce myself to you and also talk to you a little bit about where I see us going the next couple of years. First, I want to thank all of the BIO members, certainly the board of directors, the BIO staff, and our CEO, Jim Greenwood, for this opportunity to serve. I'm inspired to be following the achievements of a long line of quite eminent BIO chairs, and most recently, as you saw it, Rachel King. Just a few words about Rachel. Rachel has presided over the board with insight, intelligence, and unflappable leadership, as I think you saw. That's allowed the rest of us to rise to every occasion, really to shine as individuals and teams, and to achieve greatly on behalf of our industry. Just a few of her achievements. On her watch, BIO's advocacy ensured successful implementation of the Jobs Act, PDUFA 5, reversed FDA budget cuts, contributed greatly to the advancement of the exciting 21st Century Cures Act that's now in Congress. BIO also established the first ever BIO Patient Advocacy Committee under her leadership. We expanded BIO's advocacy and partnering events into emerging markets, and we launched the Critical Value Project, which is helping change the way our industry demonstrates and talks about our contributions to society. Please, a hand for Rachel. Thank you. I'd also like to share with you what we on the board know from working with Jim and the rest of the BIO staff regularly, and that is, this is a group of people that mirrors our industry. They have the same sense of mission, the entrepreneurial spirit, the passion that infuses our companies themselves, and as a result, they punch way above our industry's collective weight, if you will, in making our interests known, advancing those interests, and also making it easier for us to innovate and get our things done. All of us owe them a huge debt of gratitude, and let's recognize that as well. Thank you, BIO staff. So by way of introducing myself a bit more personally, I'm the son of Dr. Sidney Cohen, who was a deeply patient-centered practitioner of neurology and psychiatry, and who practiced medicine until he was 87 years old. And of Leah Cohen, who was a brilliant concert violinist and remains a proud and devoted mom. And together they showed me how science informs art and how art can ennoble science. So with that as a background, maybe it's not surprising that I began professionally as a practicing physician, a doctor of internal medicine with strong leanings toward neurology. Those of you who know me well know that I also harbor a dark secret, and that is that for 5 years I also pursued a career as an actor and a singer in New York City. It's a true story. And I entered the industry, biotechnology, in 1986, 29 years ago. And that was thanks to an introduction by medical school classmates who introduced me to a couple of their friends, scientists from NYU, who were forming a company around their technology, tissue engineering technology. And they wanted a physician who could bring the clinical acumen. And although I had exactly zero business background, my friends called me because they had seen me in plays and musicals throughout medical school. And the job description was they wanted a physician who also had presentational skills. So this is also a true story. So with that unlikely beginning, I helped build that company, Advanced Tissue Sciences. And then over 20 years ago, I founded a company myself, Accorda Therapeutics, where, as you heard, I continue to serve as CEO. So why did I do that? What compelled me to leave my prior ambitions and stay in an industry where if you're really good and really lucky, maybe you might get a new drug to market in, say, 10 to 15 years of struggle and numerous setbacks? Or likewise, a new, more nutritious crop that's easier to grow, can save millions of people from malnourishment or even starvation. Or a new fuel source that's cleaner, greener, can power our economy while still preserving our environment. But all of these with outsized risks, decade-long or longer timelines. And in fact, people ask me from time to time, you know, Ron, you've been doing this almost 30 years. After almost 30 years of pushing that boulder up the hill, aren't you tired? Aren't you ready to take up golf? And I think, you know, the only thing that's actually more frustrating than biotechnology is golf. So no. The truth is, I'm more excited now to go to work every day than I've ever been. Now, first, I get to work with some of the most extraordinary, dedicated people on earth. And second, I get to work on this kind of stuff, right? Now, what do I mean by that? I mean the leading edge of innovation, a profound balancing of both science and art, right? The greatest that the human spirit has ever produced. And nowhere has there been more astoundingly rapid progress in innovation over the past 3 decades than in biotechnology. And most compellingly, this stuff is really meaningful. Now, everyone struggles, right, to make their lives meaningful. We all do. What's more meaningful than working to make products that will advance the human condition, that will heal, feed, and fuel the world? There's a concept in the Jewish tradition called tikkun olam, which literally translates as repairing the world. And each person is called upon to dedicate their lives to this. So I hope I have a few more 30-year stints to continue to help contribute to tikkun olam, which is the very essence of our industry. And incidentally, if some of our companies succeed in what they're doing, I believe I'll actually get those extra 30-year stints. We're here together as one great whole of talented, passionate, committed people who are drawn to this industry because we want to make a difference. Because, by the way, we have loved ones who are sick. We've had friends with really bad diseases. We have fears about our children's futures and our grandchildren, our partners, our parents, brothers, sisters, friends, right? So we're right in the thick of it. We're not standing here saying, you know, we're doing all this for you. No. We're doing this for us, for all of us. So if being chair of bio means that I'm being permitted to play a role with you in all of this, in this remarkable expression of human abilities and aspirations, then I accept the privilege with humility and with great thanks. So here are a few of the things I'm looking forward to working with you on in the next couple of years. First, innovation. We're going to continue to support innovation, working with FDA, other regulatory bodies, our political establishment, patient groups, other stakeholders to further streamline and accelerate the delivery of our products to the many people who need them. We're also going to work continually to uphold the integrity of intellectual property, without which investment in innovation is crippled. Second, value. We are in an increasingly cost-conscious environment, and we're going to support our company's efforts to develop new ways of demonstrating the value of our products so that the focus is not on cost, but rather on the value delivered for the dollars that are spent. And third, communication. We're going to further expand and improve how we communicate and educate about the value of what we do to society stakeholders, such as patients, government bodies, the media, and others. Society needs to understand, for example, that for every dollar spent on innovative medicines, total healthcare spending is actually reduced by about $7.20. That's a report from the National Bureau of Economic Research. Or, for example, that US biopharma companies spend over 23% of all domestic R&D across US businesses. And that's a total of over $500 billion since 2000 alone. Fourth and not least, the patient's voice. We're going to build on the progress we've made in the past couple of years, continuing to reach out to patient groups, seeking their input in our deliberations in the drug development and regulatory processes, and also in how we're articulating the value of our products. It's a pretty ambitious agenda, and we have a pretty ambitious group to get this done. So in closing, I'd like to touch on two specific points about how we communicate. Okay, first, when a therapy doesn't work for a patient, what do we say? We say, the patient failed the therapy, right? You hear it over and over. So in medical school, one of my great teachers taught us a lesson that I have always carried with me through clinical practice and in industry, and that is never say that the patient failed the therapy. Why not? Because patients are scared and anxious. Their conditions frequently disrupt their jobs, their families, their entire lives. Don't they have enough to worry about without us putting the burden of an inadequate therapy on their failure? The patient doesn't fail the therapy. They don't fail. The therapy fails the patient. And yet, our entire industry, even the media, uses this phrase constantly as if it makes up for our failure to have delivered a therapy that helps every patient fully. The words count, and communication counts, and even small changes in how we express ourselves can have an outsized impact over time. So, in my inaugural as chair of BIO, I'm issuing a call to all of our member companies, to our media followers, and to BIO itself to conscientiously change the way we express ourselves in this regard. Because in so doing, we will elevate further the respect that we show to the patient, right? And our determination to continue to innovate to the point where our products indeed will never fail the patient. Second, and speaking of communication about innovation, I'm very pleased to announce that this week, the BIO board unanimously approved a change to BIO's name itself. From the Biotechnology Industry Organization to now the Biotechnology Innovation Organization. It's still BIO, but now with a name that better expresses the essence of what our members represent. And the BIO staff is going to be working on this, on all the logistics. We expect the name to take full effect about the beginning of next year, 2016. So thank you again for your trust and the incredible privilege of serving in my new capacity as the chair of the Biotechnology Innovation Organization. Thank you.